Hello everyone, this is Dr. Madhusudan Rao and the program I teach medical students. In today's lesson, I am going to talk about Romberg sign. Romberg sign is a component of the central nervous system examination. This particular test will tell you about the various neuronal pathways required to maintain the body balance, either during daylight or during dark. This test was initially described by one European neurologist, that is Martes Romberg, who identified the person suffering from tertiary syphilis, that is neurosyphilis, who presented to him with loss of body balance during dark. Okay. Then he said this is because of the loss of function of the posterior columns, which carry the proprioception from the periphery to the center. Okay. Subsequently, this test has been found to be very useful, a diagnostic test in order to identify certain specific neurological disorders. So, what are they? What are the anatomical basis of these particular disorders, and how the Romberg test is helpful in early diagnosis of the specific neurological disorders. So that will be the part of today's brief video. Look at this patient, that is a child patient tested for Rombergism. He is standing on one leg, trying to balance the body. Okay, this is called single leg Romberg's test. Well, Romberg's test is going to assess the body balance. This is how it is. Well, this picture shows the man is tested for body balance and stability. He is standing with his legs together and arms crossed across the chest, hands placing on the opposite shoulders. And the examiner looks for the balance that the patient is maintaining without swaying to either side or falling forwards or backwards. Okay. He will be maintaining this posture with eyes closed or eyes open. And this again a Romberg's test administered by the physician onto the patient. He is keeping his leg little apart, equal to his shoulder distance, and hands are crossed across the chest and palms placing on the opposite shoulders. And the doctor is staying close to the patient in order to protect him from falls. Well, what is Romberg's sign? Romberg's sign is a diagnostic, non-technical test. It's not a laboratory test. It is a clinical diagnostic test, which is non-technical. It will expose a specific neurological dysfunction. What is that? After removing the visual and vestibular signals, it identifies the proprioception and the related disorders. This is very important. It will identify the dysfunction of the proprioception. It is said to be positive when the patient is able to stand with the feet together and eyes open, but loses balance when the eyes are closed. Okay? So thus, it is a diagnostic tool to evaluate integrity of posterior columns, which carry the sense of proprioception. Okay? Normally, our stance is maintained by the coordinated or integrated function of proprioception that is carried by the posterior columns and visual signals and vestibular pathways. So, Romberg's test examines the proprioception after removing the vestibular and visual components. Okay. These three components, they work together to maintain our body balance. Proprioception, sense of proprioception, okay, can maintain the body balance in the absence of visual and vestibular signals. So our normal stance is maintained or governed by integrated function of three important circuits, that is vestibular, visual and proprioceptors. Integrated function of visual, vestibular and proprioception, they maintain our body balance by working together. One component compensates for the loss of other. Okay. Well, when your vestibular function is not working properly, if you can maintain the balance of the body with eyes open. Okay. When your eyes are closed, you cannot maintain the balance. That means if the loss of proprioception, that is, sensory signal is lost, ultimately you lose the balance. Okay. Here there are two important components. There is sensory component and the motor component. Sensory component is carried out by the afferents from periphery to the center. That is posterior columns, posterior spinothalamic tracts. That afferents taking the signals from the receptors in the joints and the muscle spindle, that is proprioception, along the posterior columns, that is posterior spinothalamic tracts, along with the sense of vibration, sense of touch, etc. That means posterior horn cells, they receive the signals from the peripheral receptors, and second order neurons, they go from the posterior horn cells to the thalamus. From the thalamus, third order neurons, there is the postcentral gyrus in area 312. That means the so-called proprioception that is carried by the posterior columns is three neuronal pathway. The diseases affecting the proprioception will result in loss of body balance in dark. That is sensory component of the your body balance is lost. Coming to the visual sense. Visual sense compensate when there is loss of or dysfunction of the proprioception. In the same way, vestibular dysfunction is compensated by visual signals. So that means one component is compensated by the other. So integrated function of these components will help you maintain your stance. Coming to the vestibular pathway. Vestibular nuclear complex is located in the pons. Okay? The nerve cells in the vestibular nucleus, they receive the signals from the inner ear, that is saccule, ventricle, and the semicircular canals. This vestibular nuclear complex also receives the signals from the cerebral cortex, receives the signals from the cerebellum, also sends the signals to the floccular nodular lobe and the vermes in the cerebellum. And this complex, that is vestibular complex, finally sends the signals to the spinal cord, that is lumbosacral segment of the spinal cord. This is particularly important in order to maintain the extensor tone, in order to maintain your stance. Any dysfunction of the vestibulospinal tract is going to disturb your balance. But it can be compensated by the proprioceptors. Okay. Visual perception. Visual perception counts the body balance again. And Rombergism removes the visual component of the body balance. Okay. This test is administered in the persons presenting with unstable gait in night or losing the balance while washing the face. While washing the face, you are closing your eyes. Then your proprioception, when it is not functional, then you lose the balance. Okay. Proprioception. This is 3 neuron pathway that runs in the posterior column from the periphery. They run in the medial lemniscus of the opposite half of the body to the cerebral cortex in the postcentral gyrus. Perception of vibration, touch, and 2-point discrimination are some of the other functions of the posterior columns. Okay. Cerebellum also plays an important role in governing the body balance and stance. It controls the coordination of the motor function. And Rombergism as such will not evaluate the cerebellar functions. No. This test is administered after examining the cerebellar signs. We have got to evaluate the cerebellar functions, then only do this particular Romberg sign. Because you should not get confused cerebellar ataxia for positive Romberg sign. Okay. After eliminating the cerebellar lesions, then administer the Romberg test in order to understand the integrity of the proprioception. Okay. That means basically Romberg test is assessing the functionality of posterior columns, especially proprioception. What are the indications, especially for administering Romberg sign? Romberg sign is generally carried out as a part of the neurological examination, but in certain of the disorders, it is going to be positive, like vascular lesions affecting the spinal cord, like lesions of the posterior spinal artery, going to cause the infarcts involving the posterior horn cells, thereby causing the damage to the posterior spinothalamic tracts, which are responsible for taking the signals of proprioception. Then traumatic lesions of the spinal cord, as you see in the Brown Sequard syndrome. They also result in loss of proprioception. So positive Romberg sign. Tumors and neurosyphilis, in which this particular test has been carried out and identified positive. And other conditions in which the posterior columns are affected are vitamin B12 deficiency resulting in subacute command degeneration, alcohol intoxication, Wernicke's encephalopathy, and Friedreich's ataxia. By and large, the patients presenting with the history of loss of balance and inability to maintain the stance during night, they have to be tested for Rombergism. How do you carry out this particular test? Explain the procedure of the test to the patient. Ask him to remove the shoes and the socks. And let him stand with the legs close together or little apart as the shoulder distance. Okay. Ask him to keep his upper limbs crossed over the chest with the palms on the opposite shoulders as I showed, as you have seen in the pictures. Well, then in the first phase of the test, let him maintain this particular position with eyes open for about 1 minute. And you must be very close to the patient in order to protect him from falls. In the second phase, ask him to close the eyes. Okay? And let him maintain this posture for 1 minute and observe for his stability. This is how you have got to carry out the Romberg's test. And this test is said to be positive when he is able to maintain the balance with eyes open, but his face this side or that side, or falls forward or backward, and eyes are closed. This is called standard Romberg's test. There are more sensitive Romberg's tests that are called sharpened Rombergism or sharpened Romberg's test, single leg stance test, sitting and rising test. In sharpened Romberg's test, you ask the patient to stand with toes of one foot touching the heel of the other foot. Okay? This is called tandem posture. And maintain this particular posture with eyes open as well as closed for 60 seconds. This is more sensitive than the standard Romberg's test. Again, there is single-legged stance test. Another one is the sitting and rising test. This will tell you about the integrity of the axial muscles. In cerebral lesions, when the axial muscles are involved, associated with the truncal ataxia, and this particular test becomes positive, sitting and rising test. Romberg's test becomes positive when there is loss of proprioception. 2. Uncompensated unilateral or bilateral vestibular function. And 3. Lesions of the vermis or paravermis. Okay. These could be due to trauma, due to vascular lesions, or due to tumors. Okay, and this is important in order to demonstrate the Romberg's positive sign to make the specific dysfunction of the posterior columns. Hope you could understand the point. Romberg's will tell you about the integrity of the proprioception carried by the posterior columns. Okay. Proprioception is nothing but the position of your body. It will speak about the position of your body in the space. Say giant sense. And proprioception is important in order to maintain your stance. And one of the component of the three components, that is vestibular and visual, together maintain the body balance. Okay. Thank you very much for patient listening. We'll meet you again in the next class. Until that time, bye-bye.